So I'm here with my good friend Konrad Slynarski, who's the organizer with his colleague Jacek of this fantastic congress. And this is the fourth Joint Preservation Congress, Konrad. Tell me, what made you think about putting this together? Because it's a very big effort to put something together.
Yes, but we can see a very high demand from our patients for the joint preservation procedures. Definitely they are very interesting for our patients. Everyone wants to save the knee as much as possible, and we believe that these solutions for knee and also for other joints are much better for the patients than putting the metal replacement. So this is why from the beginning we were inviting doctors from all around the world that would come and give us the top notch presentations about the current biological treatments.
It's like a who's who of sports medicine, surgery and joint preservation. I mean, many of these people are from personal connections though, aren't they, in terms of your personal friends?
Well, that was one of the things that we had the idea that we should invite the people who are into the philosophy of the joint preservation and people who are our friends. So this is why this is a very nice time any year when we have a joint preservation meeting, because it's not only a scientific meeting but also meeting old friends.
And I tell you, the amazing thing for me is, I'm always looking for new ways of treating my patients, as you know. And I've learnt so much over the last 2 days. But something that I only noticed really 2 years ago at the last Congress was the use of fat-derived stem cells. Mm-hmm. And this is something that you've been interested in for many years, isn't it?
Yes, I had this great opportunity in my life that as a young resident I took off for 1 year. And I spent this year with Arnold Kaplan when I did my PhD on mesenchymal stem cells, and this was 16 years ago. And a couple of years ago, Arnold brought my attention to this brilliant Italian surgeon, Carlo Tremolada, who invented the apparatus for harvesting the mesenchymal stem cells from adipose tissue. And it was really fascinating discovery for myself, for my practice. This completely changed the way I treat my patients. And it's actually a little strange for a surgeon that I do less surgeries since I started to do lipogems. But I think it's important that I do the surgeries only when they are really necessary.
Absolutely.
So I think there is a group of patients that benefits from the injection, and as we now are approaching 3 years follow-up since I started, I can clearly see that there is a group of patients who still benefits for
3 years.
For 3 years from one single injection.
And going back to your presentation, your numbers are 300 now, aren't they?
Well, yeah, this is over 300 patients, different indications, starting from osteoarthritis, which is probably the most common indication for myself. But also, we use this every time that we want to support the healing and improve the biologics. So when you think about all procedures that we do, like ACL, osteotomies, meniscus, cartilage, everything is really benefits from adding this little injection to the whole picture.
Fantastic. And in terms of how we move forward with lipogems, do you see it as becoming mainstream? Do you think fat will work its way into the orthopedic surgeons delivering this, globally as a very common procedure?
Yeah, I think that in Poland and in Europe and also in the United States, the numbers of surgeons that are starting with the lipogems are increasing, and I think that that reflects the current research and understanding on adipose tissue. I think it's one of the most underestimated tissue and organ actually in our body, and this tissue secretes so many substances that can influence even the brain control. But what's most interesting for us is that they support the healing, and I think that this phenomenon is clear for patients, for many of my colleagues who are coming to me and asking to help them to start.
Well, it's exactly what we've done. So purely on the basis of your experience, having seen you and other leading surgeons around the world using this technology, we've started to use it in the UK in our regenerative clinic, and so far we've had some extraordinary results. I mean, not everyone's responding. How many patients would you say percentage-wise actually respond, say for osteoarthritis? What's the response rate? Do you think it's 70%, 80%? What would you say?
I would say that there is about 80% of response in my patients. So if you compare to, for example, other drugs, pharmaceuticals, they might have even a non-responsiveness rate up to 30%. So I think that for the therapy like this, I think that this is very low. And what's also very important that we didn't see never any single serious complication from
No serious
the injection.
complications at all.
Actually, we've been using this on a very difficult scenarios like infections and non-unions and a lot of things that are making problems for orthopedic surgeons. And the worst that can happen is small bruises on the skin, which is none of my patients ever considered to be a problem.
A complication.
Yeah.
Thanks a lot, and congratulations on a brilliant congress.